TCM health betterment update for spring update. So every quarter I have my updates for my alumni, participant, or whoever keen to learn more about what's going on. So this is a TCM health betterment for February 2026 updates. This is my profile. I consider red. I don't want to delve into this part of it. And just let me take the opportunity to share about my company, TCM and U. TCM and U was established in 2003 as a website. I'm an engineer by training. I set up my own personal website. So it was with the earlier intention to let you just what you need to know about TCM to become a beautiful you, stronger you, calmer you, smarter you, and healthier you. As a marketer by training, to me, TCM talking about all the health betterments, it's better to look in for the needs basis. So all my entire design of my programs, my courses, my products, and my services are basically wrote around this particular area. Beautiful you, stronger you, calmer you, smarter you, and healthier you. So this is my regular update. So now let's talk about what we're going to discuss today. Today, I'm basically sharing with you what I have sent to all of you in words form. And now I'm speaking to all of you in a more lively approach. So if we are touching on TCM background or TCM health betterment approaches, Chinese medicine approach to health, there's more than one way. And what you'll be learning is what you're going to do, what you can do in the coming months. When the weather changes, what can you do? Because one of the important things when it comes to health betterments is about preventions. And knowing that things will change and understanding how it change, we can take precautionary measure before it change. Rather than being reactive, we can be preventive. And I'll share with you at the same time some cost review. I understand that the rush for utilization of the SkillsFuture Credit that expired in the December 31st, 2025 has already passed. But there's another component of $500. Many of you yet to use, and you can consider using them as a means to help you in your study. And all my courses besides SkillsFuture approved or eligible is also approved under NTUC UTAP. And you are recommended to be an NTUC member, and where you can get 50% rebate for the course fee that you invest. So I'll be give you some discussion. I'll discuss one very important topic that many of you always ask. When can I be cured? Why the treatment takes so long? So this will be what we'll be talking today. Something extra. So let's talk about the TCM health approaches to health betterments. In Chinese medicine point of view, health betterment is a process. Every one of us went through the process of growth, from the little baby to a young adult, to a wise senior, to a graceful elders. So this process of growth is basically aligning with different phases of health betterment. And basic principle of health betterment basically look into the following: to prevent before disease strike. So prevention is very important an element. Modern medicine acquire evidence base. But my stand for evidence is I'm not against evidence base. But when things become evidence, it's too late. So how can we prevent before disease strike? By understanding where we are. Who am I? For example, for those attended the medical diet class, you will understand. The best diet is not a diet someone tell you so. The best diet is a diet that meet your current needs based on who am I, where am I, the season of the times. So we should take prevention before it happens. In the unfortunate situation where there is already a condition that you are currently facing, to intercept before pathological changes. For example, if you are currently experiencing hypertension, you have diabetics. This is a symptom. This is a condition. Most of us can survive with all these conditions throughout life. We can live together happily ever after. But the question is when there's a complications, and that's where things become very nasty. So to intercept before pathological changes is where intercepting, understanding the current nature of the symptoms, and take precautionary measure before it change. That itself will allow you to prevent or live together happily ever after. My most senior diabetic patient is 98 years old. He is a very graceful eldest, very happy-go-lucky. I like to talk to him. I learned a lot from him. So to intercept before pathological changes and to nourish after recover from disease. And this is an important element of relapse prevention. Never fall in the same place twice. We are told, but many of us here typically will come across a situation that you have seasonal illnesses. Every year at a certain time, certain disease will occur. And you take it for granted. It's about time it comes. The question is, if that been the case, if it's predictable, means it can be prevented. So let's highlight how to prevent, or in the case of nourish after recover from disease. If you are weak in a certain, for example, for TCM qi deficiency, you are typically prone to flu and cold, hyperhidrosis. Can we do something to get this over and done with, or at least prevent it from further detrimenting your health? We can nourish. So modern medicine lack the nourishing part of the equations. And we also look into the particular aspect of according to season, timing, locality, and individuals. This is especially true when it comes to diet. Diet is always look into seasons. And I always tell my participants, those in the medical diet class, I only eat seasonal fruits. I only eat durian twice in the year. One in July, one in the December just passed. The rest of the time I don't eat. So this is basically the typical health betterment principle that you should adopt. Meaning 未病先防，治病防变，灾后防护. For those who would like to hear me speak in Chinese, you can always join the Chinese class later, after around 8:30. So let's move into what we're going to talk about. Timing, 因时因地因人. So in the discussion for seasonal health management approaches, I have a discussion I share in November 4th, 2025. Let's move on into our today's topics on Li Chun, the awakening of spring, seasonal health updates. So what is Li Chun? So some opening reflections. For those that joined me in November, did the cooler weather we discussed earlier, 4th November, actually arrive? Many experience cooler morning and evenings, stronger winds, and wider day and night temperature differences. So we have passed through that phase, and we are still into that phase. And do you manage to keep yourself warm and well? Those who don't will be coughing right now, so be having some fever and flu right now. So what we highlight here is seasonal awareness and timely self-care determine how well the body will adapt. If the body can adapt, it's a physiological response. If the body fails to adapt, it becomes a pathological changes. So you notice that globally, up north, northern region are experiencing extreme cold and prolonged winter. Their building collapse due to the snow accumulated on their roof. Singapore, though near the equator, responds to the same solar rhythm. Singapore is 1 degree north. So whatever happened in the north will have some significant impact to us in Singapore. So for those who claim that Singapore have no seasonal change, I will show you a chart in a short while. For those who attended the medical diet class, this is a refresher. So cooler wind, humidity, and rainfall influence health subtly but significantly because dampness is one of the key pathogenic factors that linger on in our body. So when you talk about seasonal idea, seasonal transition in Singapore, February to April is a climatic transition period that we're going to discuss in this particular sharing tonight. Warm days contrast with cooler, windier morning and evening. When it comes to the daytime, the moment past 11 a.m., the weather becomes very hot. Because nevertheless, we are 1 degree north. We're still near equator. But the moment when the sun set or before the sunrise, it will be very cooling. So do bear in mind that during this period, try not to exercise too early in the morning. Common complaints include allergies, coughs, fatigue, and digestive discomfort do come about and coincide with the arrival of a significant solar term, beginning of spring. So what is the solar terms? For those who are not aware of this, A solar term under UNESCO Intangible Cultural Heritage of Humanity. This basically is a 24 solar term known knowledge in China of time and practices developed through observation of the sun's annual motions, and it has been inscribed in 2016 on the representative list of the Intangible Cultural Heritage of Humanity. In Singapore, the Botanic Garden and the hawker center culture already been inscribed under this particular honor as well. Every 15 days, we are looking at the changes of weather. So we are now currently operating in this particular area. Fourth, so around March, early March, you'll come across many thundery shower at the moment. Let's see whether is it correct or wrong. So this is the time where we are entering spring. So what are you going to do in this area? In the beginning of spring, or the spring awakening or spring commencement, it marks the beginning of spring in the Chinese calendar. Date 4th February 2026. I suppose I initially intended to run this preview on Monday, but I have some other thing to manage. So it signals the initial rise of yang energy. So this period is where the yang energy start to move in the body around us. So yang energy is developing and unstable at this stage, and cold and dampness has not fully retreated. You still feel the coolness, especially in the morning. And this creates an internal-external mismatch and trigger fatigue among many of us. So during this period, wind become more active and often combined with dampness. And wind damp mostly affect the lung and the spleen systems. This is a season coincide with a lot of what we call flus. And if you want to look into area later I share with you, those with weaker constitution are more vulnerable. So this is where the changing climate during the solar term corresponds to a high incidence of infectious diseases, such as outbreak of SARS. If you can recall, for those senior enough, typically around this period, COVID-19 around this period, and the recent increase in cough, severe cold among many friends, including myself. I have a cold recently. So therefore, it's very important to remain vigilant during this gathering and adhere to a safety measure for disease prevention. Wear a mask in the crowded place if you need to. And to highlight to all of those who claim that Singapore have no seasonal change. This is the average temperatures of Singapore over the last 30 years. The reason the most latest census, 1991 to 2020, the map looked the same. So this is where, when the northern hemisphere entering cold season, our weather also turned cold. As the northern hemisphere entering what we call spring season, this is a time where we're observing a case of yang arising. So for those attended the medicated diet class, we talk about a particular vegetable that most of you Chinese are buying now. It's called leek. Swan, okay? Long leek, or they call it garlic. Why you buy garlic at this time? Not so much as for the auspicious terms of counting money. It's more about eating something that's warm to be aligning with the weather changes. And we are currently operating in this period called February and March, where the weather gradually increases. And during this period, the predominant environmental factors, as we highlight just now, wind, dampness. There'll still be rain, there'll still be a lot of wind. Try not to exercise too early in the morning, because symptoms on our bodies respond significantly to the changes in the weather. So if you fail to respect the weather condition, certain illnesses may occur. And during the spring period, under the 5-element theory, for those attended the fundamental class, the spring too fast, never mind. Spring corresponds to liver wood elements. This diagram should come later, nevertheless. So the liver governs the qi flow, emotion, circulation, and the tendon in our body. Excessive liver qi, now that the spring is in sessions, liver is most active at this period. Liver qi affect the spleen, make it functional relatively weaker. And this is a time you need to smooth the liver qi to support the vitality and clarity. So for those that like to know more about this 5-element theory, the organ vital system conditions, you're welcome to join this fundamental class. The next fundamental course is running in April 10, 17, 25th, and into May. And for those who like to join the Chinese class, it's starting in March 2nd, 9th, 23rd, 30th on Monday morning. I typically run the Chinese class in the morning, the English class in the evening. If there's other requests, more Chinese class in the evening, you may like to let me know. So in this area of the weather changes, liver qi become imbalanced. When the liver qi become imbalanced, this is a liver meridians. The liver meridian is one of the longest meridian. It went all the way up from the hairy part of the big toe, lower leg, inner thigh, past the genital organ, into the body. And as it enter the body below the breast, I'll talk about this particular acupoint in a short while. It wrap around the lung, it wrap around the stomach, and it ascends up below the eye and wrap around the mouth and around this area, and then eventually go all the way to the vertex of the hip. So excess or constraint in liver qi lead to irritability and headaches. So this period also coincides with individual feeling pain. And the headache are typically right at the vertex, top of the head. And you may come across individuals having migraine as well, because under liver system, the symbiotic pair of the liver is called the gallbladder. And the gallbladder operating, manipulating around the side of the hip. And digestive system arises when liver overreact on the spleen. This can be discussed from the 5-element theory as we went through, where the liver subjugate the spleen under the restriction pathway, as well as the meridian pathway where the liver qi wrap around the stomach. Why are you experiencing acid reflux? Because you're emotionally unstable. Remember this, if you have acid reflux, and your approach in addressing acid reflux is acid diluting, there will come a time when the stomach acid no longer acidic enough. And that itself will, in a way, trigger what we call indigestions. And at this point, during the spring period, you are strongly encouraged to sleep more. Sleep quality may also be affected because of the liver system, but by sleeping, you can actually keep yourself warm. And the key health principle when entering Li Chun or the beginning of spring is to primarily support the liver qi gently. At the same time, strengthen the spleen as a foundation and protect the lung from wind and dampness, and try to avoid excessive stimulation and drastic cleansing. And for health betterment focus at this time into some so-called simple practical health method to help everyone maintain their health during the spring period. I have 4 acupressure area or point that are highlighted in the material sent to all of you, and I also recommended 3 medicated diet. So these are the, when I come to sharing of health betterment, I always advocate these 2 approach because these 2 are more easily adopted. Health betterment advice should be something easy to follow. You need to eat every day. So why not you eat something that you need? And you need to, your hand is a very important tool. You can keep yourself warm using your hand, and a warm hand is important. So let's talk about acupressure massage. The overview is it helps to regulate, acupressure can help to regulate rising energy. It can help to support digestion, emotional balance, immunity. And this approach is easy to adopt because daily practice about 5 to 10 minutes will be sufficient. So each and every of the point, about 1 to 2 minutes is more than enough. And for those who are keen to learn more about acupressure massage technique, the course will be running in March, in the month of March. So it will be the Wednesday afternoon. I was invited by someone to introduce the afternoon class. So I'm not sure whether this will be something relevant. So this will be an afternoon class on the Wednesday. So this is a course. If you are keen, I'll send out all this material to all of you who have registered for the class. And let's discuss about the 4 acupoints that we talk about here. They are sent out to all of you. So the 4 acupoints recommended are as follows. 竹山里 ST36, 太渊 LU9, 祁门 LV14, 三阴交 SP6. So for those who are yet to attend any meridian acupressure massage class, just for your information with regards to this number here, the world get to know about meridian acupuncture after Richard Nixon visited China in 1972. Ever since then, the whole world are amazed by this ancient civilization wisdom from the East. And Singapore Acupuncture Association was established in 1977. But nevertheless, in order to allow non-Chinese to appreciate what is acupoints, WHO in 1990s established a nomenclature, allowing the naming to be standardized. So ST36 stands for number 36 acupoint on the stomach meridian. LU9 stands for number 9 acupoint on the lung meridian. LV14 stands for number 14 acupoint on the liver meridian. SP6, number 6 acupoint on the spleen meridian. It can be called a meridian and it can also be called a channels. So let's go through this acupoint and how it can help us in our current months to come. So 足三里 is one of the key acupoint. It's located 3 chun below the knee, lateral to the shin bone. So this point is basically quite easy to find. Identifying forefinger with a depression on the knee. Forefinger down next to the shin. This will be the point called ST36. This acupoint is one of the most used acupoint among all the 365 primary points. So if you Google, if you still use Google, you'll come out about 4 to 5 million pages of the 足三里. So this particular acupoint helps to strengthening the spleen and the stomach. In overall, improve the digestion. It can boost immunity. So in the event of you feeling weak, a gentle whack around the site can be useful. It can enhance adaptability during the seasonal change. You can also consider doing a simple action called scraping. This is a scraper. A scraper can be used to just gently scrape downward to help to improve the functionality of the spleen, of the stomach meridians. So massage until if the warmth is felt, and you can talk about 1 minute per side. So 2 minutes. So next acupoint, we have the point on the just below the thumb. First, metacarpal bone. At the wrist, radial side of the base of the thumb, where the pulse is felt. You can put the finger there, you can feel the pulse. This is a chun pulse. So LU9 is at the wrist area, just below the thumb. Function, it can strengthen the lung qi, support the respiratory resilience, and help prevent cough, allergies, used for stress-related symptoms. This simple action of you wrapping the wrist and turn around is a very useful technique. I strongly encourage all of you to, whenever you feel stressed, you can do this. Around the entire wrist, there are many key acupoints. There are 6 important acupoints. Anyway, LU9 is here. So LU9, apply comfortable pressure while breathing slowly. You can breathe the point, or you can do this, press the point and rotate your wrist. You can stop spasm cough. So similarly, about 1 minute per side. So this is what you can do, 1 minute per side. Next, we have the LV14. LV14 is a 6 intercostal space below the nipple. Our nipple is at the 4 chun away from the midline. Nipple to nipple is considered 8 unit or 8 chun. So midpoint to the nipple is 4. Just below the breast at the 6 intercostal space. This acupoint belongs to LV14. This acute point is the last acute point of the liver meridian, where the meridian qi enter the body. When somebody experiencing a qi stagnation, a case of stress, chest tightness, you are encouraged to do this simple action, either gently press, circular massaging, or just what you call rubbing around here. As you rub, gently inhale, exhale. You have a very calming effect. So I can do so for about 30 to 60 seconds. I have a video dedicated to LV14 on my YouTube. You can go and take a look. It was recorded 2 years ago. So basically, it's a massage. If you don't body hug yourself. This acute point is very important because why ladies are prone to mass growth around the breast is because when the emotionally event energy fail to be regulated, you will trap under. So this particular acute point can harmonize the liver and the spleen, relieve the chest tightness and feeling bloatedness around the flank area. So this is LV14. And the next acute point, SP6. When we talk about ST36, ST36 is known to be qi nourishing. It's like massaging ST36. It's like taking ginseng or taking what we call black chicken or chicken per se. Nourish qi. When we talk about SP6, this acute point, on the other hand, is about blood nourishing. This acute point, forefinger width above the ankle, inner ankle, medial middleus, or we call it Li Chun. It's forefinger width above. And this area is where 3 meridians, liver, kidney, and spleen passes through this point. It can help to harmonize the liver and the spleen and the kidney. It supports digestion, sleep, and hormonal balance, blood regulation as well. It's a key acute point for women who may be experiencing period-related symptoms. So this is SP6, blood nourishing. Gentle pressure avoids strong stimulation during pregnancy. You can gently massage this acute point. And typically about 1 minute per side. So after you go through all the 4 points, it took you about less than 5 minutes. You can help yourself in doing all these points for your body. Remember, this is forefinger width. I will update the error in the material as well. Next, you look into the medicated diet. When you go to medicated diet, what is a good diet? There's always this question. Someone will tell you a keto diet is good. There are some of you here happen to be vegetarian. Is vegetarian diet good? I beg to differ. They talk about Mediterranean diet. Talk about Nordic diet. Question is, should you eat Mediterranean diet? And there's always a question asked, why somebody in German can eat something, why can't me? Why a Japanese can eat that particular item, why can't me? Why Korean can eat the thing, why can't me? People like to say this word, but that question itself already gives the answer because you are not in Japan. You are not in Korea. You are not in Germany. You are in Singapore. So where you live, you should be eat where you live. And also knowing one thing, who am I? So for those keen to learn more about medicated diet, the course will be running again in April on Wednesday night. So if you're keen, you can join the course. And the dietary principle for spring is to look into the following. Should be warm, light, and easy to digest. Because this is a period where the qi is growing. Weather is still cold. Wind are changing. Avoid excessive raw, cold, or greasy food. I never said no. I like sashimi. I drink Coke. Can you imagine a hot Coke? Cannot, right? So idea is avoid excessive. Once a while, by all means, go ahead and do that. But cannot be continuously do the thing. And consistency is more important than heavy tonic. So every day, drink something, eat something that nourish your body. If you're keen to explore, I have a series of tea just developed. I've yet to put in place the marketing stack for the material, but it's already been sold and given to those participants joining my classroom class. And you can give it a try. I mean, health betterment is a daily activities. Eat what you need to eat, drink what you need to drink. So when it comes to medicated diet, I'm recommending the following. 3 medicated diet recommended. Yam, coax seeds, or called Chinese barley porridge. Pear, lily bulb, and almond soup. Light chicken soup with ginger and goji berry. So let's look into this particular recipe. So this is to strengthen the digestion, reduces dampness. Dampness is still in the air, and as a Singaporean, we are living in the island surrounded by water. Our most fundamental pathogenic factor that affect all of us is called dampness. So this is where you can consider Chinese yam. This one is good for kidney, good for the lung, good for the spleen system. We have the coax seed, which is also known as Chinese barley, about 30 grams. Rice, red dates. Red dates, you can, depending whether you are warm body base or normal cold body base, you can remove the core if you feel heaty. Water about 1.2 liter. So method is to soak the barley for 2 hours. Simmer all ingredients for about 60 minutes until it becomes soft. Consume warm in the morning. You can consider this. For those who can help to reduce dampness in the body, you are not recommended to take them at night. In the morning, in the afternoon, still okay. For the pear, lily, and almond soup, moisten the lung, relieves cough. Pear, one medium, cut into chunk or something like that. Dry lily bulb, sweet almond, rock sugar, small amount optional, because with the pear inside, it's already sweet. Water about a liter. Simmer gently for 30 to 40 minutes. Drinks warm. And with a light chicken soup, support the qi and gently warm the yang. Your chicken, remove the skin. Fresh ginger, red dates, goji berry, water 1.5 liter. You can just boil them. Blanch the chicken briefly. Then simmer all ingredients for about 1 hour. Consume warm. Try to avoid overly rich seasoning. And during this period, you are strongly recommended to, in a sense, lifestyle alignment, sleep slightly earlier and wake calmly. Weather is cold, sleep earlier. Choose gentle movement over intense exercise. Try to do exercise only when the sun is up. There are individuals out there stick their time of exercise to the hours. Every morning 5:30 must go out. This is no good. In TCM way of health betterments, your timing of morning exercise should changes according to the seasons. Should change according to the season changes. So protect the body from wind after sweating. So just a close reflection of what we've done so far. Seasonal health is built through awareness. So gentle adjustment to prevent illness. And this basically spring renewal begins with balance. And as I highlight, I have something more to discuss with all of you. This thing is something new. Healings take times. I'm Dr. Clement Ng. So why this particular topic for discussion in this current seasonal updates forward? Questions such as how soon will I recover? Why is this taking so long? Are increasingly common in clinical practice. I have patients come to see me after a week. How come not cured yet? How come I'm still having this problem? How come I'm still having not recovered yet? I always highlight a very important statement in Chinese, 兵败如山倒, 病气如抽丝. When illness occur, it come in the sense, whole thing, lock, stock, and barrel come unto you. You take 5 years to build a building. You take 1 second to collapse the building. It take another 5 years plus maybe 1 more day to build the buildings. So it's very important for us to understand healing takes time. and often misunderstood. Healing is time-dependent, biological and physiological process. All our bodies, different tissues, heals at different speeds. And it also coincide with the important aspect, how old are you? Before 40 years old, you don't do anything, tomorrow you can be better you than you today. But after 40 years old, you're going downhill. Tomorrow if you don't do anything, you're definitely getting worse off. We are aging. Sometimes a Chinese statement, 我派的时候, it can be a better statement than when can I be cured. So that's why symptoms relief and complete healing are not the same. So there are issues in our body, there are different parts of the body. For example, in area like rapid turnover tissue, days to weeks. Your skin, you have a cut, you have a problem, within 5 to 14 days, it can show results. For example, one of the diagram that I showed in my fundamental class, maybe I show to all of you here. This is a patient of mine where she has a skin problem. So this is where you can see, first day when she see me, it's like this. 1 week later, 7 days later, improve. 14 days later, we can shake hands. So this is where the condition is at the skin level. The recovery can be fast. So 5 to 14 days. If a digestive system condition, mucus, 3 to 5 days. If a cornea surface, 24 to 72 hours. Condition happen around the blood vessel lining. It may take 1 to 2 weeks. I will giving you a write-up of all this after the class. It's a very comprehensive writing that I have prepared. So for those operating in the moderate speed tissue, take weeks to months. For example, you have a muscle weakness. Your muscle is damaged or muscle is weakness. You have pain. For those remember, I mentioned before, last 2 weeks, my leg, I cannot stand up properly. Why? The weather was cold. I'm yang deficiency. It takes me weeks to recover, to months. You have a muscle damage, it takes up to 6 months. You have tendon conditions, it takes 3 to 12 months, it takes years. You have a ligament tear, 6 to 12 months. You have a bone conditions, it can be 6 months to 18 months. 伤筋动骨, we call it, it's a few hundred days. So idea is like that, you have to have this expectation in place. And I hope all my students or participants understand this. When you go for a treatment, be mindful of the question that they ask. And the practitioner tell you 10 sessions. It's just aggregations, just to meet your expectations. And the lung may take 4 to 8 weeks or even longer, depending on how bad the condition is. That's the reason why for long COVID, some can be a lifetime. Then you talk about the other slow healing system. They take months to years. A nerve take months to years. It grows a millimeter a day. A millimeter a day. So you have a nerve conditions. Sometimes it takes very long. Brain condition, neuroplastic based recovery, depending on how the treatment has been done. You have a cartilage, often incomplete. And you have a heart muscle condition, kidney problem is a long-term adaptations. And when it comes to phases of healings, there's always a period alignment in the sense, acute phase. Then we go to the repair phase, remodeling phase, and functional adaptations. So question is, for example, when it comes to treatments, for stroke and stroke sequence management, I have a class on this. The first 6 months is very important for the patients to be able to cooperate with the health and wellness practitioners. Besides TCM practitioners, your physiotherapists, your doctors, your occupational therapists, speech therapists. The engagement with them will allow you to improve your chance of recovery. And this repairing process takes time. And for a couple going for fertility treatments, how soon can you see a result? It takes 6 months because the sperm from gestation to maturity, it takes 3 months. The eggs took 5 months to maturity. So whatever you're doing for the first 2-3 months is always prior treatments. So if you start a treatment today, the real result of the current treatment can only be seen 5 months down the road. So if you are those who cannot wait, you expect instant gratification. Everything takes time. Because pain may improve earlier, but healing continues silently. And from a TCM perspective, this approach itself also look into the field approach. Restoration of the qi, energy flow within the body, the fundamental substances within the body, the blood, the essence, and the so-called the shen, overall arcing representation of individuals. So this require time and consistency. So remember, healing is not slow. Healing is sequential. Everything, every day, something happens. So there's always a statement, a lucky practitioner treat you last. An unlucky practitioner treat you first. For example, I share with you, pregnancy take 5 months. Minimum, 5 to 6 months. So you approach a practitioner or approach a doctor, gynae whatsoever, for help in your fertility treatments. After 1 month, you give up. Another one. After 1 month, you give up. By the time you fifth change until the 4th one, and now it happened. Wow, this one very good. Question is, whose effort? It's actually the first one, no? But nevertheless, everything takes time. So remember, time is an essential therapeutic element. So this is the one extra thing I want to highlight here. It's a full report, but I want to take a few minutes to share here with all of you. So let's go back to our part. So remember, mastering the knowledge and skill in health betterment is the best gift you can give yourself, your family, and your friends. Ignorance is a main cause of many illnesses nowadays. I don't know why I sick. So we hope more friends to come and learn method in health betterments. And at this point, just highlight, I can share, I still have a group of SkillsFuture approved, pardon me, I have a series of SkillsFuture Credit approved classes. Under my own, I have the Essential TCM Skills for Health and Wellness Practitioners. These courses are approved under SkillsFutures until the end of the year. And we'll see how it goes. Union support until next year. So this is the program. If you are keen, you can come on board to learn. Since 2022, I have the program here. TCM Fundamental Exercise Diagnosis. I have a Chinese class, English class coming. Meridian Knowledge, I'm planning to run it in the month of April to May. Acupressure massage class, you can join. Medical diet class, the pediatric care application class, I'll see how it goes. And I have a women's health course. Will be coming in the month of March as well. Pain management, stroke secure, and sub-health courses. These are application-based of the class. And for this essential wellness for aging populations, we are entering 2026. We are now super age society or economy. I'm running this course again. I'll streamline to 36 hours. So this is a women course. It'll be running in the Friday of the March. Every odd month, there will be a women's class. So this is a medical diet class. And I also have courses under SkillsFuture. Some of you here are from SkillsFutures at PA. So I have more than 5,000 participants. I think close to 6,000 now, since 2016. And you can also join the Udemy class. I'm there since 2015. I have 11,000 enrollment with 147 countries. Some pass away already. So with that, we come to the end of the class. So if any questions, you can like to share. And this Meridian class will be running in the April. And I also throw in this particular 10%. You can use this particular code for everything, anything on my website, except the cost. And for those who just came on board and who want me to keep you on the mailing list, you can just click on this scan on this code to update your particular with me. And with that, I'm coming to the end of the course. So 我们课堂上见。